State health officials introduced a new metric for economic reopening. It's called the equity metric. It takes into account the county's population as well as the health of each county's most disadvantaged neighborhoods. For a county to move forward, these neighborhoods must also have a positivity rate low enough to meet the criteria. Let's take a look here. You're looking at that map that charts it. Everything that you see in dark blue are those counties that they are referring to here. The bottom 25th percentile, the ones they considered disadvantaged in California. It covers a part of North Salinas, East Salinas, this little area of Marina approaching Seaside. As we zoom back out, you could also see that this includes a big swath of South County towards Soledad and towards King City. And then as we move north, once again, want to show a look at the neighborhoods we're talking about for Santa Cruz County. It's also a big chunk of the city of Watsonville. That is where we find KION's Drew Andre live tonight to break down what impact this new metric will have on Santa Cruz County.
And Aaron, since the start of the pandemic, South Santa Cruz County has seen a disproportionate amount of COVID-19 cases. If that gap isn't closed, it could mean it'll be a longer time for the county to reopen more of its economy. The trend across the state is showing neighborhoods in lower income areas are contracting COVID-19 at a higher rate.
It is clear that South County is more impacted by COVID-19 than other regions of the county.
Although Watsonville represents less than 20% of the county's population, residents there make up 57% of the cases. Dr. Amy McEntee says it's not a coincidence.
Many people are essential workers and part of the front line. They're exposed to the public more, and they don't have jobs where you can work from home. There's a lot of crowded housing and substandard housing. And that's kind of the perfect condition for COVID to spread.
The new health equity metric will force counties to close the geographical gap in cases, or the county won't get to reopen more aspects of the economy.
It'll allow local health departments to assess whether there's an intersection of higher test positivity among communities that are struggling financially.
The two indicators will be positivity rate and active cases. Right now, the Watsonville area nearly matches the county's 3.5% positivity rate. But to limit the higher case count, County Public Health is working with community-based organizations in the Pajaro Valley. That's led to increased testing capacity and rapid results at sites like Ramsey Park, and providing funding during sick leave for essential workers through Salud para la Gente.
Is it realistic at all that the gap could close a little bit on this disproportionate amount of cases that we're seeing here?
In the last couple weeks in our clinic, we are seeing a change in the direction things are going. So we're hopeful that by continuing to educate people about protecting themselves and taking precautions and quarantining early, that we can have an impact, and we're starting to see some of the benefits of that.
And this new health equity metric goes into effect starting next week. County health officials tell me tonight that they expect to stay in the less restrictive red tier for at least another week. Aaron, Veronica.